A 29-year-old female patient walks in, high smile line, and she doesn't like her crowns on teeth numbers 9 and 10. History? The teeth were fractured when she was 16 years old. The teeth were restored with crowns. The crowns do not match the natural teeth numbers 7 and 8. And what's worse, you can see the difference in the gum line. She has a high smile line. Everything shows. How are we going to treatment plan this patient? That's what we're going to talk about today. In Practical Treatment Planning, I'm Dr. Lee Sheldon. So the patient really looked at these problems as the color of the teeth. She didn't notice the gum line at all. When she had a smile, I was able to see 5 millimeters of gingival tissue. What do you do in that particular circumstance? Here's what happened to her. She fractured her teeth. She was in an accident when she was 16 years old. The teeth fractured off probably pretty close to the gum line. And the dentist had to do the best that he or she could to restore those teeth. The crowns are serviceable, and the crowns fit well, but the crowns go deeply below the gingival line. There would be impingement upon the attachment apparatus. And so what are we going to do in order to be able to get everything to match up? We're going to talk today about how we manage this case, and manage the case through careful assessment and then treatment and observation, doing only what we need to do in order to be able to get to the defined result. So if we take a look at the tooth, we expect that we're going to see a chamfer or a shoulder that's somewhat subgingival. We already know that through the periodontal probing. I can feel it. And the gum is bled a little bit. You can see here that the gingival redness is extensive on numbers 9 and 10 with no gingival redness on numbers 7 and 8. And our oral hygiene is good. Take a look at the thickness of the teeth, and you'll notice that the porcelain is thicker on numbers 9 and 10 than on the enamel. It's more prominent than on the enamel on numbers 7 and 8. By the way, stay to the end, and I'm going to give you some crown techniques in order to be able to help you get the best gingival result possible. If we take off these crowns, we're going to find there's going to be a deep shoulder or a chamfer that's well below the gum line. And today we're going to talk about the principle of biologic reshaping, made popular by Dr. Daniel Melker, periodontist in Clearwater, Florida. We've got to think of the tooth as one piece of dentin. And the commitment to a particular dental margin does not necessarily commit the crown to that margin. What will happen if we take those crowns off? And so let's talk about the sequence of events that we're going to use in order to be able to position this gingiva in as close to an ideal position. The first thing we'll do is design temporary crowns that will have a gingival margin that is even with the gingival margin on numbers 7 and 8. So we'll design temporary crowns that will fit the existing crown preparations, putting them even with the gingival margin. And what we're going to find is the tissue will coronally migrate. How far will it coronally migrate? I don't know. But I've seen cases where patients only had crowns placed at the correct gingival margin, and even though there was a crown preparation below the gum line, reattachment occurred, and we were able to place the gingival margin where we needed to go without doing any surgery at all. That's a rarity, but it can occur. First step then is to remove the existing crowns and place temporary crowns with the cervical margin in the desired gingival position. Second step, just wait. Wait 6 weeks. See what happens to the gingival tissue on its own. At 6 weeks, then probe. If you get bleeding, and if you don't like the position of the gingival margin, then we take the second step. The second step is biologic reshaping. We'll make a small incision to get access to the chamfer, and we'll smooth off the chamfer with the rest of the tooth. And then we'll place a new chamfer in the desired position. The desired position would be where we want the gingival margin, and that would be even with the gingival margin of numbers 7 and 8. The next step would be to do a subepithelial connective tissue graft and build up the tissue. We may coronally reposition the tissue as well, but we want to do as little tissue manipulation as possible. The principle is to get gingival bulk. The bulkier the tissue, the more coronally the tissue will migrate. And then we just cement in the temporary crowns in their current position. Allow the tissue to migrate coronally. We'll wait 3-6 months and see where that tissue ends up. If the gingival margins are not even, we may do a little bit of crown lengthening in order to be able to get all the gingival margins even. Then wait another 3 months and do the new buildups and crowns on teeth numbers 9 and 10, and we're done. So now here's the bonus. How do you design the crown so it does not push the tissue away? And that is to put a little concavity at the gingival margin, a little bit of an S-curve right at the gingival margin. The body likes concavities. It likes places for the tissue to fit in. If we make the surface convex, it will reject the gingival tissue. If we make it concave, then the tissue will tend to move down. Same way as you make a denture. If you make a denture with a concavity on the lingual in order to be able to have room for the tongue, and a concavity on the facial in order to be able to have room for the cheek, then you're going to be able to seat the denture, whereas if it were a convexity, it would act like a watermelon seed and come out. So concavities are the rule in a lot of areas of dentistry. The opportunity to get a good aesthetic result on this patient has everything to do with observation. Don't go too fast. Wait. Observe the results of the surgery. Let the tissue mature. Work with a good periodontist in order to be able to accomplish this. And you'll find that you'll be able to get good cosmetic results using Melker's principles of biologic reshaping. I'm Dr. Lee Sheldon. Please join us again next week.